It was the worst day of my life.
I kept hoping it was going to stop, but it didn't stop.
I thought, oh my God, is this contagious?
I really realized she could lose her sight.
We knew that it was bad. We knew that it was very bad.
I mean, we're talking life and death situations.
Next, two medical mysteries that defied the experts. It's a parent's worst nightmare. Two sons stricken with a deadly heart condition, and no one knows what's causing it. Time is running out, and their mother begins a desperate search for a diagnosis before it's too late.
I was becoming obsessed because I was going to save our children. I was going to save them.
Joanne Zeiss was a healthy woman in her 20s when she began experiencing strange symptoms. For 17 years, she lives in agonizing pain while she seeks out a cure for the nameless disease before it takes her sight.
Went to bed the night before and my vision was 20/20. And I woke up the next morning and it's blind.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In December 1986, Shelley and Michael Bowen welcomed their third child into the world, Michael Jr.
When Michael was born, everything seemed to be fine. He cried, he had all of his toes, he had all of his fingers, and didn't have a hand growing out of his head. Everything looked absolutely perfect with him.
But when Michael is just 2 days old, Shelley notices something is wrong.
He sounded really congested, like he had a cold. It was a horrible cough for such a tiny baby, and I could feel him rattling.
Shelley immediately takes Michael to the pediatrician.
He had a respiratory infection. It was just the sort of thing children have when they're born.
And the pediatrician told us that his immunities had not developed, and it would be best if we just didn't expose Michael to anyone for a few months.
Within weeks, Michael's 1-year-old brother Evan starts getting sick too.
They would have these unexplained fevers, or they would develop just these horrid cases of diarrhea.
At first, the Bowens aren't worried.
They were about the same age, only about a year apart. They're playing together all the time, so it didn't really seem unusual to me that if one got sick, the other one got sick as well.
Then, both boys develop a bizarre skin condition.
It started out as a little red dot, and then it would get very warm, and then it would raise up, and then it looked like the skin would just want to open up.
They looked like bug bites. They looked like they had little bug bites, on their face and sometimes on their arms.
We were told by the pediatrician that they were getting clogs in their pores. We needed to start bathing the children 3 to 4 times a day, and it didn't work.
After a few days, the rash mysteriously disappears. Shelley assumes it's harmless and isn't concerned when it comes and goes in the next few months. But when she notices that neither boy is hitting his developmental marks, she's worried.
Michael and Evan were slow to their milestones. Like they rolled over a little slower than the books would say that they needed to.
I was kind of following Evan around with the video camera. I noticed that his walk was a little bit unusual, and his gait.
Look at that walk.
Still, in every other way, Evan and Michael behave like normal toddlers.
Whenever the boys were well, they were very normal. They played, they were social, they had their imaginary friends and their imaginary games.
Michael and Evan were more like twins, really.
Evan was the older of the children, but Michael was the one that tended to be a little bit more in control of the situations.
Michael, give the water hose to Evan.
2 weeks after the Christmas of 1987, Michael, now 1 year old, begins acting strangely.
He would not eat. He refused his bottle. He would crawl just a little bit, and then he would look at me and smile, and that was about all he could do. He was very listless.
I came from school, and he was crying. His face looked like it was a little bit purple.
When I picked him up and I held him up next to my chest, I could feel his heart pounding into my chest, and I knew that he was very sick.
The Bowens rush Michael to the emergency room.
They did some normal routine tests, drew some blood, they did a chest x-ray.
And I said, does he have pneumonia? And she said, I think the doctor needs to talk with you.
Almost immediately, we were informed by the doctors that there was something very seriously wrong. There was an x-ray that was shown to us, and it didn't look right.
His heart was huge. It was almost, his entire chest cavity was almost full, and it was of his heart.
The doctors inform the Bowens that Michael's enlarged heart is weak and not pumping normally. He could have a simple infection, high blood pressure, or something much worse, like heart disease.
I wanted to vomit. I was ill. I went to the restroom because I didn't want to cry in front of anyone. And when I came back in, they were coming in with a crashed cart, and they were pushing us out of the way and telling us that we needed to move back. And I could see the fear in my son's eyes. The world went in fast motion from that moment on.
Michael is admitted to the Pediatric Intensive Care Unit while doctors try to figure out what's wrong with his heart.
You have all types of life support devices and monitoring devices and intravenous drips, and all of this suddenly attached to your child.
I asked the pediatric cardiologist what was going on. He says, I don't know what's going to happen, but I can tell you it's going to go one of three ways. He's going to get better, he's going to die immediately, or he's going to die over the next 2 years.
Tests reveal that Michael has myocarditis, an inflammation of the heart muscle possibly due to infection. It's a dangerous condition that can quickly turn deadly. In order to treat it, doctors must first find out what's causing the infection.
So they ran a lot of blood tests to try to figure out what was going on. Was it a virus? Was it a bacterial infection? And we weren't getting the answers except to say that this has been going on for a while, and we couldn't figure out when it all started. Did it start when Michael came home from the hospital? Did it start with his cough? Did it start when I gave birth to him? When was this magic moment that we missed that we could have saved our son from being in the hospital?
While Shelley is with her youngest son in the hospital, Aunt Linda is watching his older brother and sister at home. Suddenly, 2-year-old Evan begins showing signs of sickness too.
I noticed that Evan was having some upper respiratory type symptoms also, and I called Shelley. She was in the intensive care unit and said, we're bringing Evan in.
So I thought, oh my God, is this contagious? And there was an emergency room pediatrician who literally patted me on the back and said it would be like lightning striking twice in the same place for these children to both have the same illness.
ER doctors examine Evan and are shocked to find that his heart is also enlarged. The doctors are baffled. How could Michael and Evan be suffering from the same heart problem?
No one had ever seen the circumstances of where two siblings about a year apart would be coming into the hospital with the exact same conditions of heart failure.
Evan and Michael are put in the same hospital room.
For the first time in 11 days, these boys were reunited, and I had not seen Michael so happy as when his brother, whom he was very close to, was there.
After 3 weeks, the boys eventually stabilize on their own, but doctors still have no idea what's going on. Evan and Michael are placed under quarantine.
Nobody was allowed to come in without being completely outfitted with fluid-resistant clothing. They had to wear gloves, had to wear masks.
They were scared that it was contagious. They didn't know what was wrong with the boys and if they could pass it to me.
They didn't know what it meant. Nobody knew what was going on with my children.
One-year-old Michael Bowen and his 2-year-old brother Evan are quarantined in the same hospital room. They are both suffering from a mysterious heart inflammation, and doctors have no idea what's causing it.
There was a physician that was called in who was a specialist in epidemiology, and he wanted to evaluate the boys to see if they had taken something that was toxic, if I had given them something to make them sick. He asked us a lot of questions. He asked us where we lived, what have the boys been exposed to, what's going on inside of the house. The questions were very personal. Did you have promiscuous sex? Was Michael promiscuous? Did you ever give your children drugs? Have you ever taken cocaine? Do you take cocaine now?
They were just considering every possibility, no matter how outrageous that possibility may have been, and it was very distressing to us.
The boys were tested for AIDS. They were tested for tox screens. They were tested for viruses and bacteria infections and all types of things.
All the tests come up negative, but the epidemiologist still isn't satisfied. He sends a team of investigators to search the Bowens' home for anything suspicious.
They looked under my cupboards, they went into the drawers, they went underneath the cabinets, they went through the house with a fine-tooth comb.
We discovered that there was a fracture in the foundation and that there was some condensation or something that was working its way up.
Inspectors determined that the condensation could create the perfect environment for certain molds that release harmful spores and can cause infection. Though they can't prove that there is any of this mold in the Bowens' home, they think it's likely. They label it a sick house, and the Bowens are forced to move.
I was eager to get away from the house. I felt that we had found the cause of why the children were sick, and if we got away from the cause, that it would be done.
6 weeks later, Evan and Michael are released from the hospital and move into their new home. They have been put on medications to strengthen their hearts, and Shelley is told to monitor them closely.
You know, I kind of became this neurotic mother. There were nights when one or both of the boys were sick, and I would go in and I would put the stethoscope on their chest and I would fall asleep next to them, listening to their heartbeats. I was becoming obsessed because I was going to save our children. I was going to save them. 2
years later, on a family trip to the circus, the moment Shelley has been dreading happens.
Michael was just sitting there just enthralled and just watching everything. Evan could not get comfortable. I got this sense that something wasn't right with him.
It appeared that Evan was having some difficulties breathing.
I just knew that he needed to be seen. I was at the point that I was almost frantic.
The Bowens rush their 4-year-old son to the emergency room. Evan's heartbeat is weak and abnormal, but doctors won't be able to determine why it's not pumping well without examining the heart muscle itself.
They recommended a heart biopsy, which is a procedure where a very small portion of the heart muscle is actually removed for examination.
Evan is quickly prepped for surgery.
I handed him over to the doctor and I said, take very good care of him. So my husband and I went back out to the waiting room and we waited. We heard that there was a code blue in the catheterization lab, and Evan was in there.
Just minutes into the procedure, Evan goes into cardiac arrest. Doctors scramble to resuscitate him.
And it took them 10 attempts to get his heart back to where it was beating again.
The procedure is aborted. Evan is alive, but doctors are back to where they started. They've got a 4-year-old boy whose heart keeps failing, and they don't know why.
And I said, what are you going to do? And he said, well, we don't know what we're going to do. We don't know. And I was sick of we don't know. I am sick of we don't know.
The doctors tell the Bowens that Evan's heart has deteriorated. He now has a condition called cardiomyopathy, meaning his heart muscle is too weak to pump blood through his body.
And this was different than myocarditis, which was an inflammation of the heart caused by an infection. So now we had moved from an acute illness into a chronic illness that was going to last probably the rest of their lives.
Shelley wants every possibility considered.
I felt that every stone had been turned over except genetics. Why would you have 2 boys and 1 girl who was seemingly fine, and 2 boys developing a similar situation?
A geneticist is called in to examine the boys. He thinks Shelley may be onto something and shows her a paper describing a rare hereditary heart condition. A few of the symptoms match the boys, but it isn't a diagnosis.
This thing was like a nameless disorder, and it was not anything. It was just a description, and essentially everybody that was in this paper was dead.
After 6 days in the hospital, Evan has stabilized and goes home with no answers.
There was this sense that we were on borrowed time. We were really on borrowed time.
2 months later, Evan's time runs out.
Evan one morning got very sick. I had to go to the market, and I came back, and he had managed to crawl out of his bed and was laying right in front of the door. He was laying there crying. He was just very tired. He was extremely tired.
Terrified, Shelley calls her husband and rushes Evan back to the hospital.
And as soon as I got up to the floor, it was apparent there was something seriously wrong.
Evan was in cardiac arrest. Again.
A code was called. They worked on him from 7 o'clock that evening until 11:30 that night.
They were preparing to move him to another hospital that was more equipped to deal with that type of trauma.
And I said, when they transfer, him, I asked if I could go with him, and I couldn't. And it was the longest drive. It was just across town. It was the longest drive I've ever gone in my life.
When the Bowens finally make it to the hospital, Evan's heart is weak and barely beating. He's in critical condition and fighting for his life.
They took Evan into the PICU. We knew that it was bad. We knew that it was very bad. They had been working on him an extraordinarily long period of time.
And then his body just gave out on the 23rd of June in 1990, and he died. And I needed tissue.
I'm not going to describe it to you because I don't ever want you to understand how it feels.
It was the worst day of my life. It was the worst day of all of our lives, really.
After Evan's death, all eyes turned to his younger brother, Michael. Would he be next?
And I said, I will be damned if I'm going to bury another child, because it almost killed me to bury one.
A year has passed since Shelley and Michael Bowen lost their 4-year-old son, Evan, to a mysterious heart condition. His younger brother, Michael, is suffering from the same unknown illness and could be next. The Bowens are terrified.
Are we going to lose another child? Are we, is Michael going to go downhill?
Shelley shares her fears with Michael's new pediatrician, Dr. Patricia Blanco.
Her concerns were very serious concerns because we're talking not scraped knees and not little boo-boos that kids get. I mean, we're talking life and death situations.
Michael is put on a regimen of medications to strengthen his heart and prevent it from getting worse.
He was taking Lenoxin, which would strengthen each beat. And the ACE inhibitor was to stop progression of the heart failure and the cardiomyopathy.
Michael seemed to be doing much, much better than Evan ever did.
For the next 6 years, Michael is stable. And by the time he is 10 years old, he is doing so well that his cardiologists decide to wean him off of his heart medications. Then disaster strikes.
I was noticing that he was getting more fatigued. His pallor was not good. He was, he was kind of dusky looking. That old feeling of dread came back, and I knew that something was not right.
It's happening all over again. Shelley races Michael to his doctor. He's immediately put in the intensive care unit.
The cardiologists were very concerned. They felt that he should be placed on a transplant list because his cardiac function overall appeared to be deteriorating.
All of the things that we had lived through and my worst nightmares that had been realized were now resurfacing.
But Shelley refuses to stand by while another son is taken by a disease no one understands.
My wife is just not the kind of person to take no for an answer, or to take I don't know for an answer. She doesn't give up. She's relentless, and she took it upon herself to find out everything that she possibly could.
Shelley and Dr. Blanco start sifting through boxes of Evan and Michael's medical records.
We decided that there was more to the story that we needed to figure out.
She came over to my house and we just laid all of the paperwork out on the floor and we began to compile the chart.
We tried to go back and just try to look at every piece of information.
And she began to put all of these pieces together.
Dr. Blanco notices a paper that she thinks describes Michael's symptoms exactly.
When I read it, was like, oh my gosh, Shelley, this geneticist is suggesting that there might be this rare condition that, Michael might have.
It's the same document that was given to Shelley by the geneticist 6 years earlier. But now she sees it in a whole new light.
And it was called fatal infantile cardiomyopathy and neutropenia.
Immediately upon reading this, I realized this could have been written about my sons.
And if somebody can describe it, then somebody can help us. And somehow, in my mind, I thought there was a glimmer of hope.
Shelley calls the author, Professor Peter Barth, a pediatric neurologist in the Netherlands.
And I said, do you speak English? And the voice said, a little. And I said, could I please speak with Peter Barth? And the voice said, this is Peter Barth.
They probably spoke for an hour and a half, 2 hours. She went over all the details of everything she knew about the boy's case, and arrangements were made immediately. He said, I want you to come to the Netherlands. I want to examine Michael.
She was so excited the next day. She goes, he's agreed to see us. He's agreed to see us. We just have to get over there.
Professor Barth asks for samples of Michael and Evan's muscle tissue to be sent ahead so he can compare their cells with another child's with similar symptoms. 6 weeks later, Shelley and Michael fly to Amsterdam, hoping for answers.
I knew that my time was limited, so I wanted to get this out in the open and just say, we're here because I'm looking for a diagnosis. Since 1988, we have been chasing this rabbit, and we're trying to find what's going on with my children. And I've got to know. If I know what it is, then we can fight it.
10-year-old Michael Bowen is suffering from the same mysterious heart condition that killed his brother Evan 6 years ago. Now, Michael's mother has a clue that might lead to a diagnosis. A pediatric neurologist in the Netherlands has tested her son's skin cells for a rare genetic disease. Shelley and Michael fly over to get the results.
Michael wanted to go see windmills. That was the one thing he wanted to do. And Dr. Barth said, I'll take you to see windmills. So we went around the countryside, and we were sitting on a bench in this garden, and Michael was running around in this maze, and all I could see was his little head popping up and down. And Dr. Barth said, I've compared the tissue specimens. The biopsies are very similar. And he said, it is Barth syndrome. Michael does have Barth syndrome. It was a very powerful moment for me because this long quest for a diagnosis had finally come to a close.
Barth syndrome, named for Peter Barth, is an extremely rare genetic disorder. It affects mostly boys and is passed from mother to son on the X chromosome. It is characterized by 4 main symptoms: heart muscle weakness, a compromised immune system, fatigue, and growth retardation. Barth syndrome currently affects around 100 known families worldwide.
Barth syndrome wreaks incredible havoc on the human body. The heart itself can go into heart failure. You can have fatal arrhythmias where the heart suddenly stops. Children are sometimes overwhelmed by infection because their immune system just can't quite fight off the germs effectively. Unfortunately, there is no cure for Barth. We still don't know what is the average lifespan of these children.
After the diagnosis, Michael remains on medications to increase the strength of his heartbeats and regulate his heart rate. Professor Barth advises Shelley to never take Michael off his medications.
He had given us great hope that Michael could survive without a transplant and that supportive care would buy us the time that we needed until more was known about the disorder. The greatest hope for my kid to survive is to develop treatments and to know what's going on inside of his body.
Now 18, Michael, one of the oldest survivors of Barth syndrome, leads a normal teenage life.
I really enjoy photography, so I want to work as a photographer. I like to play video games and hang out with my friends, but I don't really do anything different from anyone without the disorder.
He does things that the average 18-year-old wants to do. He doesn't clean his room like the average teenager doesn't. You know, he has hopes and dreams for a future, and he plans on it.
Because his fragile heart risks getting tired, Michael avoids strenuous exercise.
I always knew that I couldn't play sports, but I didn't really let that stop me from doing anything.
One of the things that I've always tried to impress upon Michael with Barth syndrome is to explain to him, yes, you have Barth syndrome, and it's something that you have, but it's not who you are.
In 1998, Shelley started the Barth Syndrome Foundation to raise awareness about the disease and to honor the memory of her son, Evan.
Evan's life is not defined by Evan's death. Evan's life and the legacy of Evan's life lives on, and to never have known that precious child for 4.5 years would have been far worse than the loss of him.
I don't have many memories of my brother, but what I do remember was we were really close. So to get out the information about this disorder, to try to help the younger kids, is really important to me.
My son, Michael, is amazing. I couldn't be prouder of him because he's grown into the man that I always dreamed he would. And the little boy that didn't have hope is now a man.
Michael Bowen was just a baby when he became ill. But Joanne Zeiss was 22 when she began experiencing the terrifying symptoms that would stay with her for the next 17 years. It all started when Joanne began seeing things.
I was standing outside with a bunch of my friends, and I remember looking up and I saw what looked like a flock of birds just flying around up in the sky. I looked at my friends and I said, "Why are those birds always up there?" And they all looked at me, and nobody said anything, and so I knew then that something was wrong.
She had thought she had seen birds, but she realized there weren't any. And I think that was pretty scary for her. She felt like she was seeing things.
Joanne works as a graphic artist, and any problem with her vision could have devastating consequences. She wastes no time making an appointment with an optometrist.
He told me that I had something called floaters in my eye, and that they're little pieces of debris that break off from the edges of your retina and just float around. Go home and forget about it. So that's what I did.
Joanne gets used to seeing the specks floating in her field of vision, but a year later, the floaters are accompanied by intense pain.
Well, I walked outside and it was a bright sunny day, and I noticed that my eye hurt immediately as soon as I looked towards the light. When I came home and I looked in the mirror, I saw a red ring around the colored part of my eye, and if I looked very closely, I could see that there were tiny little blood vessels that were showing in that red ring. I panicked.
The doctor notices Joanne's iris is red and swollen and prescribes steroid drops to reduce the inflammation. But a few weeks later, they aren't helping. What's more, Joanne's vision is getting blurry and starting to affect her work.
Joanne mentioned the waviness when she was reading as a major problem.
It literally was like looking through a layer of cheesecloth.
Joanne rushes back to the hospital, where she's referred to a specialist, Dr. Stephen Foster.
Joanne had already lost some vision in the left eye when I first saw her. Joanne had uveitis, or inflammation inside the eye, that was affecting her vision, and she was referred to me because of that.
Uveitis is an inflammation inside the eye. There are 4 types. The mild forms affect the front structures of the eye, but in the most severe cases, the inflammation damages retinal blood vessels in the back of the eye.
If it affects structures that are truly critical for good vision, like the retina or the optic nerve, it will blind a person.
Fortunately, Joanne has a mild form of uveitis, and her retina has not been affected. Dr. Foster prescribes more steroid drops and puts her on a strong anti-inflammatory drug. The effects are hit or miss.
The next few years were a progression of taking the pills, using steroid eye drops, and having things go away, and then it would recur again every 4 to 6 weeks. It was like clockwork.
Joanne probably saw a doctor Twice, 3 times, sometimes 4 times a month.
But because Joanne is changing jobs throughout this period, her health insurance plan is also changing, and she finds it difficult to stay with one doctor. Each new doctor who examines Joanne prescribes a new course of treatment.
One of the doctors sat me down and he suggested giving me steroid injections behind my eye. He said that this would put the medication directly in the area of my eye that needed the treatment. The first thing that ran through my head was, no way, you're not coming anywhere near me with a needle.
1 week later, Joanne receives her first steroid injection.
Every aspect of her was braced up for this.
Just the thought of it, I can't imagine what that must have been like.
The doctor told me to lie back on the table and that I needed to stare up and try not to look at him as he's coming towards me with the needle. And I remember not feeling so much pain as an incredible amount of pressure. And the amount of pressure was almost unbearable.
To Joanne's disappointment, the one injection has little effect, so the doctors prescribe a series of shots over the next 12 months. But after a year, Joanne's vision remains blurry, and her eye begins to throb with pain.
I was actually pretty frightened at this point because I had no idea what the whole thing was going to lead to.
She was concerned that she might lose her sight. It must be devastating.
Joanne goes back on anti-inflammatory pills and her vision eventually stabilizes. Then, a few months later, she is struck with odd new symptoms.
One morning I woke up and I went to go stand up, and as soon as my feet hit the floor, I just felt this awful pain through both of my ankles. The first thing that ran through my mind was, what next? I already have eye problems, now I've got this. I must be the unluckiest person in the world.
For the past 4 years, Joanne Zeiss has experienced blurred vision and mysterious pain in her eyes and joints. One morning, the joint pain is so excruciating that Joanne can barely get out of bed.
I just figured I was walking around too much at work. I was doing too much climbing, I was being too active, I was having pain in my shoulders, I was having pain in my hands.
At first, Joanne forces herself to work through the pain.
Joanne's not the kind of person who will be, oh, my hand hurts, oh, my arm hurts, oh, I'm so tired, I can't do this today. She's not sitting there, pity me, pity me. It was just, this is what's happening, I have to deal with it. And she just moves on with things.
But when the pain becomes too unbearable, Joanne seeks out help. Her doctor suspects she's having a bad reaction to the anti-inflammatory she's taking for her eye problems. He prescribes a new drug, often used for arthritis. It works.
I was amazed that my joints all seemed to feel almost normal again, and I didn't have the pain in my ankles and in my hands the way I'd had for quite a while. So life was good again.
But just as Joanne begins feeling better, she is stricken with yet another excruciating symptom.
All of a sudden I started getting sores in my mouth. It wasn't like the regular old canker sores that would be gone in 3 or 4 days. These would get red and raised up. It would all of a sudden just kind of break open and become an ulcer, and it hurt a lot.
I remember for quite a while, Joanne had to drink milkshakes because she couldn't chew.
I had to drink through a straw because that was the only way I could get the liquid down past the ulcers that were in the front of my mouth without having it hurt too much.
They were in her whole mouth, her tongue, the insides of her mouth, the roof of her mouth.
Terrified that she may have herpes, Joanne makes an appointment with her dermatologist.
He took a look in my mouth and he said, what you have right now is herpetiform ulcers. And I said, well, does that mean I have herpes? And he said, no, it's just the medical term for a whole bunch of ulcers in one small area. And I just breathed this big sigh of relief.
Doctors think ulcers can be caused by many things: stress, acidic foods, an immune reaction. There's no cure, and they must be allowed to run their course. The dermatologist prescribes some medication for the pain so that Joanne can eat. But as the ulcers come and go, Joanne begins to notice odd skin problems on other parts of her body.
I started getting these small, clear lesions on my hands and on my ankles. You know, you'd want to scratch it, but as soon as you touched it, you'd just be in agony. So I went in to go see a doctor again.
The doctor tells Joanne it's most likely an allergic reaction, maybe to her laundry soap, and not to worry. But Joanne is worried. It's now been 8 years of escalating symptoms. First her eyes, then her joints, then ulcers, and now lesions.
I was going through so many different types of symptoms that I really was kind of in shock. I couldn't believe that any one person could have all these strange things happening to them.
But Joanne hasn't stayed with any one doctor long enough for him to be able to see the big picture. She is terrified that not having one consistent physician is causing things to slip through the cracks.
I was very frustrated at the number of doctors that I had to see. I think I'd seen 6 primary care doctors, an unknown number of ophthalmologists for my eyes. So I felt like I was spinning my wheels over the years and that I really was getting nowhere.
Joanne doesn't know where to turn. One morning, driving to yet another doctor's appointment, she suddenly begins to feel as if she's fighting a battle she can't hope to win.
So I'd woken up this one morning and I'd really had it. I was actively crying in the car. You know, I was just so tired of everything. And I thought, well, there's a bridge coming up. You know, if I just turn the wheel just enough, I'm going 70, you know, I could just go into that bridge and then I wouldn't have to think about it anymore. You know, I didn't want to take it anymore.
No one can tell Joanne Zeiss what has been causing her painful eye, joint, and skin problems. After 7 years of suffering, her symptoms show no sign of letting up. Then, one morning, something terrifying happens.
There was one day that I was working, and I remember looking down and I did a double take because I wasn't seeing something normally.
She was working as a graphic artist. She was a forms designer.
And I looked down at the page, and what I was seeing was the letters that were appearing on the page appeared broken. The lines of type themselves were wavy. And I was horrified. I picked up the phone and called my eye doctor. And once I finished describing it, he told me, you have to stop what you're doing and come in now.
Joanne races to her ophthalmologist's office. The doctor thinks there is something wrong with her retina. He performs a test called a fluorescein angiogram, where an orange dye is injected into Joanne's veins to better photograph the blood vessels in the retina. The results are frightening. A few vessels have ruptured, and blood is leaking into Joanne's central vision, blinding her left eye. The only hope is emergency laser surgery, but that too is risky.
He said, I'm very good with a laser, but I can't guarantee that when I hit that area with the laser to seal off the blood vessels that I'm not going to destroy your central vision at the same time. I'm thinking to myself, either you can not have this surgery done and watch your vision go, or you can take a chance. He'd do it right. So I signed my life away and just started praying that he'd hit the right spot.
Fortunately, the laser surgery is a success. The hemorrhaging blood vessels are sealed off, saving Joanne's vision. But her recurring symptoms still show no sign of diminishing.
To not know what you have, not know how it's going to develop, and not know if there are any treatments available for you, it must be devastating.
I really kind of reached my boiling point in terms of how much longer was I going to be able to put up without having a diagnosis.
Joanne takes matters into her own hands. She makes a list of all her symptoms and searches for anything that will tie them together.
I said, there's got to be some reason why I have all of these things. So I spent so much time on the internet at that point, it was ridiculous. I started plugging in all the different symptoms that I had. Eventually I narrowed it down to a few possibilities, but I couldn't get any doctor to agree that that's what I might have.
Then, in the summer of 1997, Joanne gets another chance. After finding out that she's developed a cataract, she's referred to Dr. Stephen Foster, the same specialist who diagnosed her 17 years earlier with uveitis, or inflammation of the eye. She brings her list of symptoms to the appointment.
You know, I had my ideas about what might be wrong, but I wanted to hear from him what he would think a diagnosis would be. So I thought, well, I'll just hand it to him and see what he thinks.
She pulled out of her purse a relatively long list of many things that had happened medically.
He was amazed at the progression of symptoms.
Joanne, over those 17 to 20 years, was not leading a normal life.
He'd only seen me back then when I had just the eye problems and a little bit of the joint problems, but not this entire list of things.
Literally within seconds, it became clear what this was all about.
He just looked up at me, and then he said, you know, I do know what you have.
Well, one of the most prominent signs and symptoms was recurrent canker sores. A lot of people have canker sores, so that in and of itself does not the diagnosis make. But when one couples that with the recurrent skin lesions plus uveitis, it becomes instantly obvious that this is Behçet's disease.
Behçet's disease is a rare disorder that causes inflammation of blood vessels throughout the body. When a blood vessel is inflamed, it can irritate the area around it, leading to oral ulcers, skin lesions, joint pain, and recurrent eye inflammation. There is no cure, and the exact cause of the disease is unknown, although it seems to be most common in people of Asian and Mediterranean descent.
Currently, approximately 25% of patients with Behçet's disease with eye involvement will be blind inside of 5 years. It's not curable, and why blood vessels in the mouth or on the skin might be affected today, and blood vessels in the back of the eye might be affected 6 months later is not at all clear.
I'd come across the name Behçet's already, and I was leaning towards saying, well, that's probably what I've got anyway. But I needed to hear it from somebody who was an expert in it. And to me, that was like shining a spotlight in a dark area because I had waited so long for somebody to tell me what I had wrong with me.
Dr. Foster is the one that unlocked that key, and in a way, it's like removing a mask.
Finally had a name. Now she could do something about it.
Dr. Foster puts Joanne on a long-term treatment using an anti-inflammatory drug that can prevent flare-ups in the blood vessels of the skin, joints, and eyes. Today, Joanne's Behçet's disease is in semi-remission.
Actually, I think Joanne's long-term prognosis is excellent.
It has been quite a while since she's had any symptoms at all.
But for 17 years, Joanne suffered, which is not uncommon for people with Behçet's.
There's no test. There's no Behçet's test. It's not as if these things spring full-grown. They evolve through time. That was the case with Joanne. The first thing that began with her were the aphthous ulcers or canker sores. And it took a long time for other things to slowly evolve to the point that now it's clear. It doesn't last forever. It does have a life to it, a beginning, a middle, and an end. And I think Joanne's is on the back nine. I think she's going to be finished with this long before she's ready to say goodbye.
Today, Joanne no longer works as a graphic artist. She has dedicated her life to raising awareness for Behçet's disease.
I didn't want anybody else to have to go through 17 years worth of a nightmare like I did. And as far as I'm concerned, that's the main thing in life. If you can help somebody else, then do it.